Hello, my name is Lisa Molina, and I am the HR manager here at the Salvation Army. I am broadcasting this video today as part of a verbal review of the HERO Act. So the HERO Act stands for the New York Health and Essential Rights Act. And the purpose of this act that was entered into law in New York State in May of this year is to protect employees, such as yourself, against exposure and disease during any future airborne infectious disease outbreaks. And during this video, you're going to hear me refer to an AID, as that is what stands for Airborne Infectious Disease. So the law. Under this law, employers are required who have a minimum of 100 or more employees. We are required to create and establish what is called an exposure prevention plan. And as an employee, you have the right to have three things. One, a copy of that plan, which you should have in front of you today. Two, a copy of the plan at your work location. And three, you have the right to a verbal review of the plan. So that's what we're going to do this morning, is we are going to do this verbal review. So hang in there with me. We will try to get through this quickly but efficiently. If for some reason you have questions, if questions come to mind during the video, I would recommend jot them down. And you are welcome to either email me, call me, stop by, make an appointment, or you can even ask your supervisor. We are all well versed in the plan so that we are happy to answer those questions. So given that, let's begin. So on September 6th, our new governor, Kathy Hochul, did declare that the coronavirus, aka COVID-19, was considered is being designated a disease that presents a serious health risk and harm to the public. So when that trigger is pulled, then employers must implement and trigger and begin their exposure prevention plan. If you look on the second page of the plan, it does outline for you exactly all of our locations. So all the locations within Syracuse Area Services is responsible to making sure we have this exposure plan in place. There is also main contacts within the plan. And as you can see, Major Dean, Linda Lopez, myself, and Joel Durst, our directors of facilities, we are all the main contacts and the individuals responsible for the overall managing of the plan. And then at the bottom of that page, it also reviews the minimum controls that we want to make sure are put in place during this outbreak. And I think you're going to see that most of the items we'll review today, we're already doing. We are already wearing our masks. We are already social distancing. We are already cleaning and cleaning and cleaning and cleaning. And when we think we've done enough, we're cleaning again. But let's review it. So general awareness, it talks about maintaining that physical distancing, exercising the coughing, sneezing etiquette of making sure that you are trying to limit where your sneeze or your cough is going to cause risk and exposure to someone else. Wearing your face covering, gloves. If there is something that you are going to, a work task you're doing and you feel you need to wear gloves, we encourage you to wear gloves. Any type of PPE that you feel is appropriate, we'll make sure that is in place. And if you run out, all you have to do is ask. The limiting of touch. It's been interesting, hasn't it? That our inability, or maybe we didn't realize how much of a social society we truly are, and the typical handshake or trying to be less than 6 feet or next to someone, how much we would feel the loss of that. But it is a necessary it is a necessary task that we have to make sure we're doing. So for example, when you meet someone, we're asking, please don't shake their hand, not even a fist bump, not even an elbow bump. We've got to make sure we're maintaining that social distance. And, you know, I know that a lot of our clients, we've hugged in the past, but now hugging again is another general awareness that to keep each other safe that we're trying to avoid. And then washing your hands properly and often. We are trying to, the types of soaps we have purchased are, you know, disinfecting soaps, and hopefully somewhat hand softening. But again, it's any ounce of prevention is going to help in trying to protect yourself and your coworkers and the clients we serve. Stay at home policy. You know, here at the Salvation Army, we encourage, we ask, if you are ill, this is something that you must do. Stay home. Please stay home. Get well, keep yourself healthy and get well. Stay at home policy is always implemented here at the Salvation Army. Health screenings. I know in the beginning during the pandemic and quite for the first year and even more than a year, we had daily health screenings. Well, we will be starting to re-implement our daily health screenings, but it's also the responsibility is also upon each of us to self-monitor. If you come to work, I mean, it happens. You come to work and you're feeling great, and then all of a sudden midday you start to get a sore throat or your ear starts to ache, or in general you're just not feeling well. Go home, tell your supervisor, and go home. We want to make sure that you are healthy and remain healthy. So we will be doing the daily health screenings, but we do ask that you do self-monitor yourself too and communicate to your supervisor if you're not feeling well. We've talked about the face coverings and the physical distancing. Some of the things also we will be doing is during this plan is reducing or restricting transportation services. We will implement the temperature checks again also at the daily health screens, and reducing residential capacity to one person or one family per room. Now, that is something that you will need to talk to your program director about, but it is in the plan, so I want you to be aware of it. The next section does talk again on hand hygiene. In order to prevent the spread of the infection, employees should wash their hands with soap and water for at least 20 seconds and use hand sanitizer as well. We have, during this past year and a half, the facilities, finance, we have have done a lot to add to our inventory of face masks, face coverings, disinfectants, antibacterial wipes, hand sanitizers, cleaning supplies. So all of this is in place. All you have to do is ask if you run out. Respiratory etiquette, because infectious diseases can be spread by droplets expelled from the mouth and nose, employees should exercise appropriate respiratory etiquette by covering your nose and your mouth when you're sneezing, coughing, and even yawning. You know, we may not realize, we think about the cough and the sneeze, but, oh boy, now I'm going to yawn, right? But the yawning is another part that could potentially spread this disease. So just be careful. We were also required, and we will, of course, provide special accommodations for any individuals that have an added risk factor. If there is, if you are an employee that feels that you have some type of an added risk for catching this disease, please contact me directly. Let's talk about it. HIPAA will protect the release of that information, and I'm happy to see what we can do to help with your current situation. Advanced controls during an outbreak. So there are also some advanced controls during an outbreak, and engineering controls is one area that would be considered and advanced. And Joel, in our director of facilities has gone to great extent to help increase and improve airflow within our buildings. And so that is something that we have done, we will continue to do and monitor. Administrative controls. You know, some of the things that are on this list, again, if you look around you, you will see that they're already there. Limiting workstations, if you're sharing an office, making sure there's dividers in place. Protected screens. If you've come to administration, you notice that Michelle at the front desk has the plexiglass, right? That is one of the administrative controls that we have put in place. The food pantry and their procedures. All of this is an administrative control. And fortunately or unfortunately, it's come down to this is just a part of our daily lives right now. And we just want to make sure that we are keeping that in place. PPE. Face masks are required at all times in daycare centers, emergency shelters, residential programs, senior centers, which includes staff and clients. So we want to make sure that because we released the plan, we should all be wearing our masks. Gloves are required for cleaning, meal prep, food service at the daycares, emergency shelters, and residential programs. Face masks are also required in all common areas. Basically, look at it this way. If you are not in an office like I am currently with the door closed, and you're by yourself, you could take your mask off. But the minute you open that door, your mask must come on. If you go out to the common areas, out to the front desk area, down to the break room to use the restrooms, your mask must be placed back on. Face masks and gloves required when providing first aid also or personal care assistance to others, and that is required at all locations. So we have 2 more sections to review, and then we will have met the conditions of a verbal review for employee rights, under employee rights. And the next section is on housekeeping during a designated outbreak. So the plan reviews disinfection methods and schedules. Now listen, I understand that at every program there are already protocols in place, and I am so glad to see the protocols are already in place. So these might seem like a review, but you can also kind of use it as a mental checklist that we are doing the correct things. Because one of the main things is objects that are touched repeatedly by multiple individuals. So they're talking about door handles and light switches and control buttons and levers and dials, water faucets, computers, and phones, especially phones, must be cleaned frequently with an appropriate disinfectant. When the pandemic first hit, when coronavirus was released into our state of New York on March 13th of 2020, one of the first things that we did was to review what types of disinfectants we needed and what was recommended by the CDC and by the New York State Department of Health. And so the items that we use to clean meets those standards and guidelines. So we do have that in place already. We may have to adjust normal housekeeping procedures, and that is something that your program director or your manager will go over with you, and the entire program will decide what are those additional cleaning methods that need to be done, if any. But cleaning methods must be continued or they may be enhanced. What to do if an employee develops symptoms. So if you feel you have developed symptoms or you witness someone developing symptoms, the first thing that we need to do is make sure that we have a face covering placed on that individual, and the person that is interacting with them should have a face mask and gloves, and then the individual must be isolated. And then the next thing that you must do is contact one of the people on this list, either Major Dean, Linda, myself, or Joel can be contacted, and your supervisor needs to be notified, and then we will be able to assist and guide as to what needs to be done next. But the main thing is making sure that this person, your teammate, is removed and isolated quickly and efficiently, for their protection, and not only for their protection, but for the protection of all others in the area. We follow the guidance issued by, per this plan, New York State Department of Health or the CDC. And we also have our funders and our county of Onondaga that also help to release those guidelines. So all of the guidelines we follow are by all of those particular agencies. It also talks about liners should be used in trash containers. And, I know that sounds kind of like, oh, well, of course. But we want to make sure, again, that we are restricting and containing any kind of infectious disease. And the last thing that we need to talk about is training and information during a designated outbreak. And your program site manager has the overall responsibility of reviewing and training their team on this particular plan, but I am also here to help guide and assist with that as well, and that is why I am here today. And in closing, I think that you'll see that the plan, like I said in the beginning of this video, the plan is already in place. It's something that we are doing already on a daily basis, but it's very good to also make sure that kind of our check and balance and just making sure that we have all of these controls in place. And if you have, again, any questions or concerns, please feel free to reach out to me directly. My email is still lisa.richardson@usc.salvationarmy.org, and my direct extension is 1114. I am happy to answer any questions you may have. Please stay safe. Thank you for all that you do here at the Salvation Army Syracuse Area Services. We appreciate you oh so much. Take care. God bless. Bye-bye.